So, welcome to another episode of The Truth About the Plant. I'm Dr. Amanda Ryman. I'm one of your hosts. My amazing co host, Christina, is actually having a wonderful adventure in Japan this week. So, it's just me to bring you all of the information that you need about cannabis in a science backed public health framework. The reason we do this show is because it is so difficult to find accurate information about cannabis on the internet. You might Google a question, you get 100 different responses back, and many of those responses might contradict each other. So we're here to give you the information you need in 15 minutes or less so that you can get on with your day and get the actionable insights in order to make good, healthy decisions about your cannabis use. So I am so thrilled to welcome a very special guest to today's episode, Dr. Casara Andre, who is a veterinarian. And I've been working with Dr. Andre with my dog, Bojack. About 4 years ago, he developed a skin condition that resulted in lesions and sores on his skin. He was constantly itching. He was losing his hair. And we had tried all kinds of medications and foods and supplements. And then we decided to try cannabis. And I will tell you, after having him on a tincture now for about a month, his skin looks amazing. The lesions are gone. His hair is growing back. The redness is gone. He's not itching. He's so much more comfortable. And it was Dr. Andre and her team that really helped us figure out what the right dosing was. So I'm so excited to have you on the show today. And I'm just going to jump right into it. I'd love for you to tell us a little bit about yourself and then get into the question, how do I use cannabis to help my furry friends?
Amazing. Thank you so much, Amanda. I am so pleased to hear that Bojack's doing well. It is always a pleasure to work with any family unit that really is interested in those family unit dynamics and how that animal interacts with the humans and vice versa. So you've been such a pleasure to work with, and I'm excited he's responding positively. Yes, I am Dr. Casara Andre. I'm a veterinarian practicing in Colorado out of the United States. And the reason I always start with where I'm practicing is because that's been a big piece of why I've been involved in cannabis and why I can answer this question about whether cannabis works for your animals or not. Colorado has had recreational and medical cannabis laws for a while. And so as the veterinarian community, we've really had to respond to what our pet parents were asking us. Like many modalities in veterinary medicine, cannabis is very client driven. It is often the pet parent who has done their own research, pet parents who have listened to shows like yours, Dr. Amanda, that are just wondering, well, cannabis has helped me, or I hear lots of positives. What about my animal? They are loved members of our family, just like the humans are. And when our animal is hurting in our family, we're hurting with them, whether that be behavioral issues or skin issues or GI issues. Having a well-balanced system within our animals also impacts the well-balanced ability we have as humans to run our lives. So yes, the answer to your question is cannabis absolutely does help with animals, but there's an interesting thing that I think pet parents need to be aware of when beginning to consider that question. One is, what are your goals as a pet parent? So are you trying to use cannabis as a supplement to other modalities, pain medication, some prescriptions that are already on board, and cannabis fits really well there? But in that context, you really need to make sure that your prescriber, your clinician, whoever you're working with, knows what molecules are going into the animal. Cannabis, with many molecules, all the molecules we have of cannabis, they interact really powerfully with a lot of the drugs that we use from a pharmaceutical perspective. And that's positive. That's amazing. And we can often use them to reduce dosages of other drugs. We can use them to reduce some side effects. Sometimes we can even pull off the pharmaceuticals. But it's important to remember that we do have those drug-drug interactions. In fact, one of the medical director for our consultation team, Dr. Gaber, he just finished his master's thesis on cannabis used in the pre-anesthetic period. So we now have some really good scientific evidence that what we knew clinically, but now we have in scientific paper, peer-reviewed scientific paper, of the fact that we absolutely affect what we're doing in the anesthetic period by cannabinoid-based products that are going to the animal beforehand. So I think that's one way to think about cannabis in the treatment room, in the back of house, in the clinic setting. And it's really important that if you are giving your animal cannabis or interested in that it's a really close collaboration between you and definitely your prescriber. So if there's any other molecules or drugs going into your animal, they definitely have interactions. But I'll next answer that question. I think probably the majority of your pet parents are in of like, I just want to try. I just feel like maybe it would work, maybe it wouldn't. Someone gave me this bag of treats. Can I use them? Is it safe? And so what I want to say to all of you all is yes, absolutely. I think you should give it a try. You should give cannabis a try if you're animals. Cannabis is an amazing plant with lots of molecules and a really, really beautiful safety profile. When you're working with cannabis on your own, especially in that retail supplement, picked it up off the pet store shelf, the most important thing to remember is that you know that it's safe. So working with a product that you trust, asking for lab reports in the background, making sure there aren't heavy metals or pesticides involved. And if you're with a pretty good product from a safety perspective, you're probably going to see something positive. You're probably going to see better sleep, maybe better appetite, maybe stool forms up a little bit. You're probably going to see some general, like, yeah, I just feel better. Cannabinoids work on an animal's endocannabinoid system. So just as I'm sure your audience knows from listening to your show, animals, just like humans, have that ECS. And when we give them cannabinoid-based products, it really just helps their own balancing mechanism be a little bit stronger. So probably the odds are, no matter what you're using, as long as it's not gross with heavy metals or pesticides, you're probably going to see something positive. But importantly, that might not be exactly the tailored profile that you're looking for in maybe the more complicated cases, animals with multiple conditions, when you're really trying to get some really specific clinical work done. But I think it's always a great idea to start. It's a good idea to grab a high quality product off the shelf, start with a low dose and work your way up and see how
Let
your
me ask
animal
you
responds.
quickly.
So then I'll
Okay,
move to my next
before we move
category.
on to the next category.
Absolutely.
So I know that people might say, okay, is there a difference between like the ones that are for animals where they say, here's like CBD dog treats versus something that is something made for humans? And what about products that are available outside of a dispensary? So like I go to the store where I buy my dog food and I'll see like hemp chews and CBD chews.
Yes.
But they don't necessarily have a COA. I don't have the test results. So am I better off getting something at a medical cannabis or a cannabis dispensary where everything has that COA? And does it matter if the product is targeted specifically at animals, or are human products okay too?
Yeah, great questions. I'll answer the first one first. In the US, we often have better certificates of analysis, better lab testing on some of the products that are outside of the dispensaries. That's not true across the board, but there are some amazing companies that have just of their own willpower, we think this is good for our animals to be safe. They're doing all of this testing because they believe in it really strongly. And those products are really easy to find because if you look on their website, you see certificate of analysis written, click here, find lab reports. They're very upfront with, please know that we're trying to keep your animal safe. So that's a really easy way to just screen quickly anything that you see in the pet store. And often those products are of higher quality, or it's easier to tell what's in them than some of the products that come from a dispensary. So from dispensaries, recreational or medical, many times they've already passed so many criteria to be a state approved dispensary that they're not always that willing to give out their COAs, or they might not have tested for it in a way that's easy to give you that lab report. I mean, kind of give them the nod of like, well, we're pretty sure that you're testing. We're pretty sure that your product's safe. But I'll say from experience that it is possible to find some pretty nasty products in dispensaries. So even if you're getting a product from a dispensary, knowing who the manufacturer is, trying to do traceability, and doing a little bit of investigation is always wise.
Absolutely. So whether it's in the dispensary or in the pet store, look for that COA, look for that transparency on ingredients and lab testing, and that should be the driver.
Absolutely. And if a company's already showing that, it tells you a lot about what they know in the background, that they know that that's important. And so they're going to make it really easy for you to find that. And that ties in to your second question about using a human versus an animal product. And really, it goes back to the same answer. Can we tell what's in it? If I can use a human product that I know the molecules and it doesn't have any unsafe products, ingredients for animals, I'm happy to use a human product. Sometimes they're higher concentration, sometimes they're a little bit easier to access. But remember that many human products might have flavoring. So things like xylitol are really, really, really toxic to animals. Things like chocolate, really, really, really toxic to animals. So when you're working with a human product, That's the biggest thing to look out for. Those extra ingredients, the extra flavorings, just those don't belong in animal products. But if you are trying to cross that label barrier and trying to use something that has a human labeled product for an animal, having your COA tells you what you're working with. And I'll just mention to close that piece out that I have definitely found some animal geared products that are very animal favorable, branded with a pretty paw print, that are really nasty in the background. So again, it comes down to know your company, look for a COA, and really push for that transparency. Call the company, ask their customer service, what's in your product? How do I know? And it is those companies that meet you right there. Yes, we would love to tell you about our product, that you have
Okay,
that level of
great. So
confidence
let's
in.
talk a little bit about dosing protocol. So if I make the decision that I want to use cannabis with my animal, whether I'm using a treat or a tincture, how do I know how much to give them?
You're always going to start low and go slow. Same is true for humans. It's same for the animals, because every animal has a very unique endocannabinoid system, and how they respond to those cannabis molecules is going to depend on what the tone of their ECS is, what conditions they're dealing with at the same time, and importantly for us as their caregivers, what's going on in the household around them. So if you're going to start a cannabis product for an animal, knowing what the environment is that they're going to be in is really important. And you're going to start really as low as you possibly can. Sometimes this is literally a drop. And if you're worried about that dosing, like what is a small enough dose? That's where you can really reach for kind of that third category of someone to help you design the protocol. But most of the time, it's pretty easy to just start with as low as you can possibly go and then creep up. But I do think that that's an important time point to put in the idea of journaling, that the changes that we see happen with humans as well as animals when we use cannabis are pretty slow. And that's important. While we can see some effects in the first couple of days, maybe first couple of weeks, what we're trying to do is get that body to change on the inside. We're trying to get some of those rhythms to reset. And we're also trying to get systems to repair themselves. And that can take time. Just as an example, if we have an animal that we're working with for a behavioral health condition, we're trying to heal some neurons, and nerves take a long time to heal and to grow and to repair. And so sometimes we're met with just a objective time frame where we need to be patient and let that body shift. But for us as humans, it can be hard to chart. So when you're working with cannabis, especially if you're trying to start it on your own, keeping a journal, just a little daily log of how things are going, that's so incredibly important if you want to then elevate and ask someone to help you design a protocol. For example, a team like ours, if you can bring us 2 weeks of journal for whatever product you were using, we can look at which molecules were in there, how the animal responded, and kind of make that next leap and say, oh, great, let's add in some CBDA, let's add in some CBG. But having that baseline is
So
really,
what should
really
people
useful.
look for in terms of adverse reactions if they give the animal that shows maybe they're giving too much or the animal isn't tolerating it very well?
Yeah, the very first time we always warn parents about is GI upset. If you have a poorly made product, if you have a nasty oil that the cannabis is in, if you have just a contaminant, a pesticide, probably some diarrhea, some GI upset, some off their appetite, those are going to be the first signs that you see. And I think what's important for pet parents to hear is that you should honor that. If you're looking at your dog and you're like, you just seem off, but I'm sure it's me. I'm just making it up. If you're working with cannabis, please honor that. Those little subtle changes are actually really, really important. So again, your journaling is a useful way to help you know what's happening. So GI, upset, some vomiting if it wasn't a good fit. But then we start to think about sedation. So if you're using a little bit more than you want to, that might be some sedation that you see as a result. But I'll mention that sometimes we're looking for some sedation. So it's not always a side effect that's adverse, but we just need to be aware that it can be something that happens from cannabis-based products. And then I'll mention another important safety piece for all of your audience. Even products that are bought off the shelf, so retail, pet food store, ordered online, so not even from the dispensary. Some of these products can have a lot of THC in them. And while we love THC for the molecular strength, for the anti-inflammatory, for the pain control, if you take a naive animal and give it the dose, so it's a large dog, you give it the dose that's on the bag, that's a lot of THC to go into an animal that's never seen THC before. So you can actually make your animal pretty intoxicated, even with a product that came from a retail store. So that goes back to start low, go slow, and really watch your animal and honor anything that you see by
Oh,
putting
that
that
is
down in a
so
journal.
helpful. And I know there's so many people out there that have wanted to try this and have been nervous.
Yes.
And, I think this is such great advice. So I've been working with your team. It's been immensely helpful. If other people are interested, I know, you do teleappointments, so you can really be anywhere and take advantage. How would folks find you and your team?
Absolutely. Our website's the easiest way to connect with us, veterinarycannabis.org. You can see some information about our training classes, about our consultation programs. If you're in Colorado, I'm always happy to meet with you in person, but we consult globally. So it's really lovely to connect with anyone from anywhere. And if you are looking for that extra help of tailoring your molecules, adding something in, or especially if you're having the sensation of it's just not working anymore. Maybe it worked when you started, 2 weeks in, 3 weeks in, you're just like, I don't know that I'm seeing anything different. I don't know that it's really doing what I want to. That's probably the point where you should raise a flag in your mind of, oh, maybe I just need to tweak the molecules. Maybe I need a different profile. And those are the times when your vet, someone in your area, our team, there's lots of resources, but that's the time to kind of reach for maybe a little bit more support in
Oh,
which
well,
molecules.
thank you so much. And we'll put the link to your site in all of our promos for this video so people can easily find you. Dr. Casara Andre, thank you so much, both for joining me and for talking to our audience about this and for your help with Bojack. He's over there. He says thank you. He's having a nap right now. But just we really appreciate the care your team has taken, and we absolutely see the results. So
Absolutely. Our
for
pleasure.
all of you out there, that is our
Our pleasure.
episode for The Truth About the Plant. Make sure that you tune in, like, subscribe, share this with other people in your life that need some good science and public health backed information about cannabis. And we'll see you next time.